Hello, everyone. My name is Sean Barnes, and I'm a clinical research psychologist here at the Rocky Mountain MIRIC for suicide prevention. And I'm joined today by Dr. Lauren Borges, also a clinical research psychologist at the Rocky Mountain MIRIC. And we're very happy to have an opportunity to take this Rocky Mountain Short Takes on Suicide Prevention episode to talk about a really useful clinical assessment tool called chain analysis. Lauren has been a driving force in kind of bringing this to a lot of the clinical work that we do here and really helping us understand the value of taking this approach to suicide risk assessment to kind of go beyond some more basic techniques. But maybe we could start out, Lauren, just by you telling us a little bit more about yourself and like how you became interested in chain analysis.
That sounds great. Yeah, so I feel very fortunate that my first exposure to research and clinical training was in the context of a dialectical behavior therapy center. So there, I remember learning about chain analysis for the first time and being like, what is this mystical tool? It seems like something that could be really helpful. So then I was pretty explicit about PhD programs that I wanted to pursue that really focused on contextual behavioral approaches to intervention. And in the context of my graduate work, I just became a lot more interested in applying chain analysis, using kind of functional analysis in the moment to really understand the factors that are driving often what we consider treatment refractory behaviors to occur, like chronic suicidal ideation and suicide attempts. So that's how I became interested.
All right. Maybe we could talk a little bit more about the specifically what chain analysis is.
Totally.
And how it sort of compares or fits in with sort of standard suicide risk assessment.
Yeah. No, I think that's really important because I know for me, had I not had these very specific training experiences, I would probably not be familiar with chain analysis. It's certainly not something that's kind of disseminated throughout suicide risk assessment necessarily. So standard approaches to suicide risk assessment are hugely important and really focus on the structure of suicidal behavior and ideation. So, standard risk assessments that we're all familiar with, we're going to ask about kind of warning signs, risk factors, protective factors, frequency, intensity, intent, all of those things, which chain analysis can do as well. And those are certainly important to kind of give us anchors to compare someone's intensity of suicidal ideation and sort of the number of attempts they've had to other people within the population or in smaller groups. Chain analysis, though, is a different approach. So rather than kind of focusing on symptoms kind of or signs, behaviors hanging together, like a collection of sort of what we might say symptom topography, chain analysis really focuses on the stuff that's underneath all those behaviors. So really addresses why those behaviors are hanging together. And that's what I find so compelling about it. I think it's really cool that you can potentially, as a scientist, sort of drill down and figure out what's underneath all this stuff that's happening. And by all this stuff, I mean certainly the factors around a suicide attempt, if that's the behavior that you're working on in the chain analysis. But oftentimes coming with that, we see substance use. We see kind of avoidance of activities that someone used to enjoy. So we can figure out like what's causing all of those different behaviors to hang together and focus on that in treatment. It kind of gives us a lot more bang for our buck. Which is what got me really interested in chain analysis. So essentially chain analysis is just figuring out through a structured kind of technique what is underneath all these behaviors that I'm seeing as a clinician. And then that sets us up really nicely to intervene on those behaviors through very targeted clinical approaches. So it's really focusing on the processes underneath suffering.
Yeah, so kind of big picture, it's helping us understand and conceptualize why someone's engaging in these behaviors, and then also seeing kind of how we can break that pattern up and intervene on that pattern. If we go into a little bit more detail, so we kind of start out by identifying a behavior or a thought, right?
Yeah, totally. So you would start out. The way that we've kind of referred to it is very consistent with how it's been referred to in DBT. So right. you could call it a target behavior or problem behavior language has also been used. So if you have a target behavior, really that is anything, and that behavior can be how a veteran or a client. I'm going to probably refer to veterans a lot because Sean and I both work. We work with veterans. How a veteran is engaging with their thoughts could certainly be a behavior. So ruminating about suicide or planning, like imagining kind of a suicide attempt, that would be a target behavior, even though it's kind of not an overt behavior that we could focus on in the chain analysis.
Internal processes as behaviors as well.
Absolutely, yeah. So how that person is interacting with their thoughts, their emotions, their urges, the stuff that's going on in their body, all of that is behavior, right? How I'm choosing to relate to those experiences.
One thing for me, I know in having done a fair amount of suicide risk assessment, before we started working together and before I became more familiar with behavioral approaches to assessment and intervention, I still definitely would have identified the target, right? I mean, like, that's clear. I know that I want to help the person not engage in suicidal behavior again, or, not be spending all their time thinking about suicide rather than doing things that are important to them. But, how is chain analysis different than just saying, so why did you do that?
Mm-hmm. Yeah, no, I think that's a great point. So I want to kind of highlight something you said, because I think part of this approach is that it can seem really different and I don't know, scary in comparison to what you might already be doing, but you're actually collecting probably a lot of the information that you'd use in a chain analysis with a veteran anyway, or the client anyway, and doing a standard suicide risk assessment. So I think the main difference, I think there are a few differences. There's a difference certainly stylistically in how the chain analysis is done as an active and collaborative conversation, and that isn't to say that standard suicide risk doesn't involve that. It's just like a very explicit part of the chain, kind of working through this series of events together, so that the client can ultimately become their own therapist and be able to kind of do this for themselves. The second reason the chain is different is it really kind of allows some hypothesis testing about various features that could be driving suicide, right? So you would work to identify that target behavior in a very precise level of detail. You'd work to identify the prompting event, which is the thing that set the whole chain analysis into motion. So it might be like an argument with a significant other, something to that effect. And then you'd work backwards with the client that you're working with, piece by piece, to identify every kind of small link in the chain that came before the target behavior. So there could be thoughts that they noticed, it could be emotions that they experienced, it could be things that they did. Things that they did before they, decided to attempt suicide, or before they noticed they were kind of stuck in their head thinking about suicidal thoughts. And so that level of detail, I would say, is different. And then I would say the back end of the chain is really different. So after you kind of go through that front portion, really the whole kind of goal of this is to figure out what the function, so I'll probably say function a lot, and I don't know that I've defined that yet. So function is essentially why this behavior is continuing to occur, right? With this perspective, all behavior has a function. So even if I don't know why I did something, and it seems impossible for me to understand what led up to this, it just felt like it came out of the blue. If I slow down and kind of roll back enough, we should be able to kind of systematically together figure out okay, first this thing happened, then this thing happened, then this thing happened, which set this target behavior into motion that I engaged in. And the reason that I engaged in this target behavior is because of what it did for me. And these might not be things that I'm aware of what it does for me. So oftentimes when we talk about function related to chain analysis, we're talking about reinforcement. And I would say that kind of really highlighting and explicitly getting at forms of reinforcement is very different from standard suicide risk assessment.
I think one reason I really love this approach, and I think it really pulls for collaboration between the clinician and the client or veteran. Is that looking at it in detail and trying to like figure it out together, but then also instead of me just saying like, so did you do this to influence other people around you? We can say, so, this was happening in your interpersonal relationship prior to this target behavior.
Totally.
And then what happened with that person in your relationship afterwards?
Yeah.
Right?
And then you got
better, and that's nice. Like, there's no blame.
No, totally. There. It's very non-judgmental, right? It's a very objective. It's subjective, but it's also kind of objective in that you have it on a piece of paper in front of you. It's not like me evaluating kind of like why you were doing this and what it was doing for you. We just like know based on the information you're giving me and what you're saying this does for you that this is why this is happening. And once we know why it's happening, it's a lot easier to intervene in a way that doesn't feel like it's all my fault and I'm this horrible monster for continuing to engage in this behavior. When of course you're engaging in suicidal behavior or suicidal ideation, it's working well for you. It just might not be meeting kind of their long-term goals or consistent with their values in the long term.
Yeah, I think there's that aspect of like, this makes sense the way we've laid it out. One of the big differences being that level of detail and kind of the concrete approach that chain analysis takes relative to more of just an exploration of like, so let's talk about this event in detail.
Totally.
And
it gives you opportunities to intervene in, I think, a different way, which is nice.
Yeah, and you're a little less kind of wed to the client's insight, in that you're looking at the different, thoughts, emotions, physical sensations that were occurring leading up to the different events that were leading up to the target behavior, rather than sort of their interpretation of those things at the next level up. So maybe we've talked a little bit about what chain analysis is. Hopefully we can provide people with like a diagram of a chain analysis or something as well. Lauren also led a group recently in publishing a paper on therapeutic risk management, chain analysis of suicidal ideation and behavior, and that was in the 2019 25th issue of the Journal of Psychiatric Practice. That's a good reference if you want more detail.
And like specific examples that kind of go through sort of piece by piece with a couple, with a veteran, like how you would do a chain and then how you would intervene in the chain with some therapeutic interventions. Yeah.
So I can see, that some similarities and differences between the standard suicide risk assessment and sort of the difference between just asking a client or veteran why they attempted or why they could even think about suicide to using this more structured approach. Do you think you could tell us a little bit more about the specific structure of a chain, kind of what the typical components are?
Yeah, so the place that you'd always start with the chain is really getting very concrete and specific about what the behavior is that you're actually targeting. And this isn't multiple behaviors, this is just one behavior. So the behavior might be that your client overdosed, right? So you might be focused on...
Not like the crisis you had in 2018.
So really specific detail about the target behavior, whether it's an overt behavior or an internal one, a covert one.
Right.
And then after identifying that collaboratively using really the client, the veteran's language, you'd want to identify the prompting event. So what is it that set this whole series of events into motion? Oftentimes it might be some sort of an argument, maybe a reminder of that veteran's trauma history, something to that extent, workplace stressor. It tends to be some sort of an environmental event that causes emotional and cognitive distress, really. And so you would also then kind of work backwards from the target behavior to identify specific links in the chain. So this is everything that happened between the target behavior and the prompting event. So you would be getting at emotions and kind of rating the intensity of those emotions. You would be getting at like what specific thoughts they were having, what they said to other people, what they did, what they noticed about their experience in that moment.
So helping them drill down on like key emotions, cognition, physical sensations,
behaviors, because there are other behaviors that could occur before the target behavior, and often do, depending on what that is. And then you would identify the vulnerability factors. So what was it about that specific prompting event, that specific day and time, that made that person more vulnerable to thinking about suicide or engaging in suicidal behavior? And certainly we're talking about suicide right now in our examples, because this is something that's incredibly helpful for suicide risk assessment. But the chain is not at all limited to addressing suicidal ideation and behavior. Really, this can be used for anything. If you have a client that they want to kind of work on noticing patterns related to, figuring out why it is that they keep doing something that they don't want to be doing, and then changing their relationship to that event. So this can really be used for anything.
Really flexible.
Yeah, super flexible, which is cool. So then you have those vulnerability factors, and those can include things like not getting enough sleep on that day, not taking my medications as prescribed, using alcohol or drugs, not eating, those kinds of things that we know kind of set us all up to just have a crappy day. But those are important to identify, because they kind of help, particularly for people who might be at like high chronic risk for suicide and feel like they're just experiencing persistent suicidal ideation and maybe behavior too all the time. Well,
so for the person who says like it was the same thing as always,
totally.
I'm always thinking about
doing
that.
Yeah, actually figuring out like specifically what set this into motion can help them sort of feel, I don't know, a sense of some agency and kind of some control over like, hey, like actually there were some things that I did, and maybe things that happened in my environment that made it more likely for me to engage in this behavior. And with that context and insight can come, again, like the ability to work on some of those factors, making sure that you're engaging in self-care and those kinds of things. So that's really the front end of the chain.
To summarize,
yes.
In terms of the order that you would typically do it with a client or veterans, you'd start by identifying the target, right? So if I'm thinking about the paper kind of maybe on the right-hand side or something, is a target behavior very specifically identified. Then somewhere towards the left-hand side, I'm talking about the prompting event. So a little bit more of a concrete thing that might have happened, argument, lost job, or, a million other things that could prompt the crisis. Then you're kind of connecting those two dots, right? The prompting event and target behavior in a very detailed way, capturing thoughts, emotions, physical sensations, other behaviors. And then once you have those connected, going back kind of even further on the left-hand side of the page to identify vulnerability factors that made the person that sort of at higher risk or more likely to respond in the way they did.
Yeah, absolutely. And I think with that, sometimes you might have a client that you're working with that doesn't remember the prompting event.
Sure.
And if they don't, again, it's just like working back from the target behavior, and usually it'll be clear as you kind of go through that together, kind of what happened, what set that into motion.
This is slightly a field, but I think probably important in doing a good chain analysis. How do you usually set it up or introduce it to a client or veteran so that you help them kind of drop into that moment or reach that level of detail that's useful, as opposed to just like, this is what I did.
So usually there will be a verbal description that I provide, but also some physical things that I do in the room to make this kind of more conducive. So one thing that I'll do is I'll always do a chain on a blank piece of paper. The reason for that is really this is you kind of telling your story to me about what happened, and us figuring out together kind of what's continuing to make these things happen for you, so that we can address them. So I found that really kind of promotes a collaborative style, sitting next to the veteran that I'm working with, and really kind of drawing out the chain together.
So a little more of a genuine, like, let's figure this out.
Yeah, let's figure this out. Totally.
Rather than like, this is the part of the session where we do this work.
Yeah. I think the other thing that I'll say to them in kind of verbally setting up the chain is like, hey, so I'd like to go through this or engage in this process with you, so that we can both kind of have a better understanding of why this stuff keeps happening for you, and really be better informed for the two of us about where we can intervene. This might seem a little weird or a little bit different than something you've done before. We'll be doing something called a chain analysis where I'm going to be like, drawing a bunch of circles and arrows. Really, there's no kind of standard way that you have to do this, but it might look like a mess initially, but what this will do is it'll kind of like help us together figure out how this stuff is continuing for you, why it is that you continue to struggle with your suicidal thoughts, or why you continue to overdose on medications, or whatever they're working on.
You set up this kind of collaborative stance where you're working on it together.
Yes.
And creating this product to kind of both improve your understanding.
Absolutely.
And what if, like, say, after we figure out the target behavior, we've got the prompting event, and I say, like, I don't know what happened, I just, like, did it. Are there things that you would say to help the person, like, narrow in more on how they were feeling in the moment, or what they were thinking?
Yeah, so, I mean, I think there are a couple things you can do. I mean, I think one of them is that I would ask really specific questions about, well, what kinds of thoughts, were you having? Or if someone else was sort of watching you, what would they see that you were doing? Like, what would they notice about your experience? If you can't remember it during this time, are there other times that this has happened for you, and what experience did you notice in those times? I think usually, though, asking pretty targeted questions like, what emotions were you feeling? And if then someone doesn't have like the verbal repertoire to be able to identify what emotions they were feeling, then kind of figuring out, well, what is emotion kind of symbolic for them? Well, maybe that's maybe you can describe that as like some sensations in your body, like, oh, well, I think I was feeling tightness in my chest. Oh, well, what is that related to for you? Like, what kind of thoughts were happening with that? So yeah, I think just asking really specific questions about like what their experience was like and their experience of their environment was like, it tends to be a way to address that.
So we've kind of talked about the front end of the chain, right?
Yes.
The vulnerability factors, prompting event, all the individual pieces in between the prompting event and what led to the target behavior. And then what would typically come after that?
So the back end of the chain.
The back end
of the chain. Nice. So I think so after the target behavior, it's really figuring out what the consequences of the target behavior was. And so I would say that kind of the links right before the target behavior can give you some insight about that. And then obviously like what happened right after the target behavior. And the kind of ways that we've conceptualized that really, behavior kind of is maintained, if we're being very behavioral, and then thinking about the principles of human behavior through positive and negative reinforcement. So oftentimes the consequences of the chain really mirror that. So for instance, to kind of give some more context into what I'm describing, a veteran might feel incredibly hopeless. And just like, there's no point. Like, I've done all this stuff. There's no point to living anymore. So then they might kind of engage, like the example I gave earlier, in fantasizing about suicide for, a period of time. And they might find that in fantasizing about suicide for a period of time, they feel some relief from their hopelessness. So they feel less hopeless. They might feel less anxious. They might feel less sad in general. And we would call that kind of pattern negative reinforcement. So negative reinforcement occurs anytime I engage in a behavior and it reduces or takes away some sort of an aversive consequence for me. So that relates to emotions, it relates to thoughts, it relates to kind of anything that we're that we're experiencing. And unfortunately and fortunately, humans learn very effectively based on this, right? So if I learn that, I really, speaking is hard for me. I don't like doing it. I don't like speaking in public. I'm super, super anxious, right? So I'm very anxious. So my target behavior in this situation where I'm very anxious is I'm going to have a drink. Well, that's gonna make me less anxious, which means that now I've learned that to cope with speaking in public, I have to have a drink before I speak in public, and certainly I've not done that. But I think it's a nice example that we can all relate to, right? Of how powerful, how powerful it is when we find something that really immediately and temporarily relieves our anxiety. And just like using alcohol, planning for a suicide attempt. Really ruminating about suicide, engaging in more kind of engaging in a suicide attempt, all of those things can provide very powerful relief from the pain that I'm feeling in the moment. So that's kind of one way that the consequences can look. There are really kind of three scenarios that I think we tend to see. So that's just very basic negative reinforcement. Yeah. Then also, oftentimes suicidal behavior and suicidal ideation can persist due to positive reinforcement. Right. So that is interesting because I think that tends to be where there's a lot of stigma. Like this person was being manipulative. They're engaging in suicide to get their needs met. And actually, the manipulative part is not true. But getting their needs met, I think is a very valid point. So let's go through an example maybe with positive reinforcement.
Yeah, I think that's a good idea.
Cool. So let's say that I get in a fight with my partner, with my significant other, and I feel like he's just not really hearing me at all. And then I'm like, well, I'm gonna engage in suicidal behavior. I'm gonna do something to hurt myself now. And then I see that he cares. I see that he's supporting me. He's like, oh, what can I do to help you with this? How can we kind of work through this together? I'm here for you. I'm here to help you. That is that is what we would call positive reinforcement. And the reason that's positive reinforcement is I wasn't getting any support from my environment. Then I engage in the target behavior, and now I'm getting support from my environment. And that doesn't mean I'm trying to manipulate my environment. It means that I'm getting my needs met through my environment because I have something that's desirable and potent and important to me to have support from my significant other. The problem is that just makes that with both positive and negative reinforcement, because of the change in my experience that I get through those target behaviors, it makes it much more likely that I'm going to engage in those behaviors in the future. So once I learn that, hey, this behavior gets me support in this context, I might use that behavior a lot more in that context to get support. And it's not because there's anything wrong with me. I'm learning from my environment about how to kind of interact with it to get what I need.
Hey everyone, just a quick break from the show to let you know a couple things you can do to help our show get even better. First, write us, let us know what you think, and give us your ideas for guests and topics. You can reach us at rockymountainmyrec@va.gov. And second, click your subscribe button on whatever it is you're using to listen so you never miss an episode. And now back to the show.
Definitely. And I've certainly worked with people too where it's not even necessarily conscious. It's one part of the scenario, and they can see by looking at one side of the chain. If you're able to pull out some of the relationships or things that were happening between people beforehand, and then what was happening after, there's a little bit more of an aha,
totally.
I guess that does help me get support that I need to cope with this issue. How about you have positive reinforcement that is external behavioral, right? So people expressing caring or being more involved.
Yeah.
What about, are there internal or kind of personal examples of positive reinforcement you could give?
So oftentimes veterans in particular that we work with will identify engaging in suicidal behavior, suicidal ideation, because it creates a sense of peace that wasn't there before, or creates a sense of control that wasn't there before. And that can be conceptualized as positive reinforcement too, right? I feel completely out of control. like everything is crumbling around me. Now I start engaging in very specific behaviors to plan my suicide attempt, and then I attempt suicide. I feel like I'm in control. I'm totally controlling that scenario. Like I am choosing everything I want to do to lead up to that, which I think is also incredibly powerful. And so, of course, why wouldn't they engage in whatever behavior it is that's causing them to feel in control? It just again has really significant consequences for the long term if there are other things that they care about and want to move towards in their life.
Yeah, that's a nice example, I think, of more of an internal, addition of this positive experience.
I think the third thing that I referenced that we often see is that this verbal and kind of this covert and overt behavior is really complicated in humans. So oftentimes suicidal ideation or behavior is multiply controlled, which means that there are elements of positive and negative reinforcement happening at the same time. So for the veteran that like we just talked about, someone who's engaging in suicidal behavior for a sense of control, that might also mean that when they engage in suicidal behavior, they feel less anxious or less guilty or less ashamed, which would mean that both positive and negative reinforcement are kind of operating at the same time. And that's just really important for figuring out like the kinds of interventional strategies that you'd want to use. So yeah, really to kind of summarize the back end of the chain is all about identifying what's causing this behavior to persist. What happened immediately after the target behavior? What happened not just behaviorally, but with your emotions, with your thoughts, with your urges, with your sensations, with all those things we don't want to feel as humans. All those things that are
just
painful.
Like the consequences of the target behavior.
Exactly.
Kind of short term. And do you consider longer term things like hypothetical example? You're stressed out at work. Now, after an attempt, you're in the hospital and not at work. Could that be a longer-term consequence you would include, or would you typically stick more to short-term when you're looking at consequences?
I think when you're looking at consequences in the context of the chain, it's really important to talk about the short-term kind of immediate consequences. But I think when talking about the point of intervention and like where you're going to intervene and why you're going to intervene in specific ways and how it's connected to your values to not engage in suicidal behavior or to engage in these behaviors instead, I think you'd absolutely want to link that to the person's long-term goals and values and reasons for living and all of those things. There's one other thing I wanted to say about consequences. So with positive and negative reinforcement, it's not always that you're adding something and removing something. There just might be more of something or less of something. Yeah. So it can be really helpful to rate, I was feeling shame at a level of 10 intensity prior to engaging in a suicide attempt. After engaging in the suicide attempt, I still felt shame because I feel shame all the time, but it was less. Maybe it was like a 7 on a scale of 0 to 10. That can be helpful for people sometimes when it's not so cut and dry, which is, I think, what we tend to see in our population.
Most of the time,
right?
Yeah. Because it is so complex, these events typically, and I think that really nicely highlights the value of being really specific, making sure you're covering different domains in terms of thoughts, behaviors, physical sensations, events, and getting a really detailed description of them so that it's easier to sort of compare and contrast what was happening before the target event and what was happening after the target event. It also takes away that stigma piece around saying, I'm doing this to feel better, I'm doing this to influence, other people. It's more just like, I can see that I was a 10 before and then I was a 3 after, in this emotion that I'm trying to get rid of.
I think that's a good point. The chain can both be simultaneously validating to the veteran's experience or the client's experience. It can also be aversive, right? Because you're actually asking the person to go back to this experience, which is causing them to experience kind of facets of that in the moment with you in the room, which is kind of cool because then you're already creating a context where they start to learn how to interact with that pain more flexibly. Yeah. So it's kind of can be thought of as a mini exposure in that way, just putting them in contact with some of the stimuli that they would experience at home in these kinds of events.
I think the chain is also a nice way to help people approach that. Instead of avoiding it. Because I think often it's easier to say, oh, I did this because I got into a fight with my girlfriend, or I did this for, more of this like surface or kind of big picture reason. Than to really sort of rehash and go through the thoughts and emotions and everything that was taking place.
Totally. So I think I've mentioned, like, there are points that you can intervene in the chain, but the chain itself is also an interventional strategy, which is kind of what we're describing right now. It can be used between the client and provider to just practice slowing down. Practice kind of, you're talking about things that happened in the past, but as you talk about those things that happened in the past, how do you become present with them in the room with your client? So if you have a client who is talking about the intense sadness that they feel prior to thinking about suicide or engaging in suicide, part of the work in doing the chain might be slowing down a little bit to really describe and observe that sadness and kind of notice, how does it show up? What does it look like? How's it showing up right now? Creates a nice kind of context for new learning.
Well, we've talked about what the chain is, kind of what different components are, and I know we've sort of foreshadowed that you can use it to inform intervention. Maybe we could talk a little bit more about how you could use a chain analysis to inform what you would then do in therapy with a client, or even, what you would recommend that they do in terms of other interventions.
Totally. Yeah. So I mean, I think the kind of primary thing to attend to here is what the target behavior is and the consequences of the target behavior, right? So if I'm using this behavior and not like overtly knowing that I'm using this behavior for this purpose, but if I'm thinking about suicide to get some relief from my emotions, well, that gives us some evidence that this person has difficulty regulating their emotions, difficulty tolerating distress. So then what I would do is we'd kind of brainstorm together and figure out, okay, like where on this chain would it have been helpful to practice these skills on the front end prior to the target behavior? Then kind of once you engage in the target behavior, what makes sense? I mean, they might be hospitalized, but certainly if they're hospitalized, like what kind of interventional strategies kind of could they use to get themselves to the hospital or to once they're in the hospital? That's kind of beyond the chain. But yeah, so I think the primary thing that it does is it gives us evidence about the function the target behavior is serving, so then we know what kinds of skills to practice with the veteran to kind of map onto that. So if I'm getting relief or something like that from thinking about suicide, emotion regulation and distress tolerance skills I might try could include using something like that, and I'm going to probably reference a bunch of DBT skills because I think those are really helpful for crisis survival. There's a lot of evidence that supports that.
For sure.
Something like changing my facial or body temperature. So I might recommend, like, if you're having a really kind of visceral physical response to your emotions and it's really unpleasant and you don't want to feel that way, so you engage in this behavior that isn't values consistent for you, then we might try instead on the front end, what would it be like to kind of hold ice on your face, or even stick your face in a bucket of ice water. That's a cool skill that can activate the dive reflex, and when you're kind of focusing on intense physical sensations like that, you can't be simultaneously stuck inside your suicidal thoughts. It's impossible. So those kinds of strategies that are really physical can be really helpful because they provide kind of an opportunity to focus your attention on something else in a way that's also tends to be more values consistent for most people. I think the really important thing with like skills like that is that you try it with someone in a session first. So one, so they like kind of know what to expect, and two, you know how it's functioning for them to engage in the exercise.
So kind of practicing the different skills you use to interrupt the chain in the future.
Yeah.
And making sure that those are effective,
totally,
kind of well rehearsed and seen in session.
Yeah, and like knowing, like it's always so funny to me when I do like a mindfulness practice or an exercise like this with someone, and it's not funny. That's the wrong word. Interesting, and it kind of triggers something that I totally would not have expected because I don't know that person's individual, like the details of their whole learning history, kind of leading up to working with me in that session. So I think it's just the cool thing about the chain is it's idiographic, so you can make the interventional approach approach is really ideographic, really individualized too. And I think that's really critical. So yeah, just knowing how it's working for that person, and with different distress tolerance and emotion regulation skills, I'll recommend. People, often have different kind of ideas about how those will and won't be. So it again, like, well, let's just try it together in session. And trying it together means the two of you actually engaging in the skill together, and then both reporting on what your experience is like of holding ice or engaging in a mindfulness practice, or with the piece about feeling like, I gave an example earlier about like feeling like, I'm not getting support from my significant other, so then engaging in a suicide attempt or suicidal behavior to because I get support as a result. I think in those contexts, interpersonal effectiveness skills can be really nice, and so those are obviously skills that the client needs to learn and practice. So kind of learning like how do I kind of get my needs met in this kind of a situation without engaging in this behavior, right? Like how do I interact in my relationships and ask my partner for support in the presence of these really strong emotions. Without needing to engage in suicidal behavior, because there's usually another option there. Of course, I think one thing I would highlight when I'm talking about that is that this is about you and your skills and your behavior. We can't force anyone to be effective on the other end. Yeah, totally.
Two-way street, but kind of empowering them to see their own role and being able to meet their needs in a way that's more consistent with their values.
Mm-hmm. Oftentimes, so we talked a little bit about emotions. If I have someone that's like really stuck in like there's no meaning in my life, there's no point in living. Like what's the point? I've just that really kind of like existential suffering. I might recommend and do some assessment to figure out like, what is actually meaningful to you? What are some different areas of meaning in your life? There are a couple tools we often use in our consult service. So we will evaluate like someone's values. There's some formal measures that we use related to that, like the Valued Living Questionnaire that assesses kind of importance of values, behavior that's consistent with those values. I might also, and I also often do like a values card sort or something like that in session with a client to kind of figure out like not only like what are things that matter to you, what do you want to be about, how do you kind of want to prioritize those things, but also like what's physiologically and what's cognitively coming up for you while we even talk about these values, like what are your experiences in the presence of these values, because that can often be a barrier to people actually engaging in them.
Yeah, the values card sort is one of my favorites, just with how concrete it is, and I think it's also really interesting, sometimes useful to see what values might be relevant or were included in the context of the crisis in the chain, where sometimes like the things that really cause people a lot of distress or things that they care a lot about. So I've seen the chain also bring kind of point in the right direction in terms of more values work.
Totally.
I know I think our lens tends to be a little bit more contextual behavioral, but how could this be used in, say I'm doing cognitive therapy for suicide prevention or CBT for depression, and I want to, incorporate this chain. Would it be inconsistent, or how
not at all? Yeah, I mean, I think you can. I think as long as you're attending to the true like behavioral consequences of what is causing this person's behavior to persist, you can use any kinds of interventional strategies that have evidence for whatever the thing is that the person is noticing. So oftentimes we'll integrate like the safety plan, which isn't particularly wedded to
some of
So we'll talk about like, well, once the prompting event happens, how can you remember to look at your safety plan? So that like usually involves step 6 of the safety plan, which is kind of like structuring your environment such that you have cues to be reminded of your safety plan. So, like maybe, I should have a copy of my safety plan on my like car mirror. So when I'm getting like pissed off while I'm driving, I see the safety plan and I'm reminded that I have some options and I can slow down. Certainly, you could recommend, again, on the front end, if someone's like, we often see veterans who are engaging in PTSD treatment, cognitive processing therapy, to engage in a challenging beliefs worksheet related to their, some of the thoughts they have about being worthless or a monster or a failure, depending on
so a lot of
whatever their content is.
Rich cognition or potential,
Totally.
Whether it's like a dysfunctional belief underlying it or a stuck point and CBT, a lot of that comes out in the chain too, and can be targeted that way.
Yeah, I think another nice intervention that is kind of like more atheoretical. Certainly, there are some DBT skills that reflect this. Is kind of in approaching the vulnerability factors. So, making sure this again really maps on nicely to step 6 of the safety plan. Making sure that you are doing all the things that you should be doing to take care of yourself, like setting reminders on your phone, maybe to like eat breakfast and take your medication, those kinds of things. But also removing things from your environment that are harmful and you often use to engage in suicidal behavior. So it might be removing alcohol or things that would just make it worse for you in a crisis.
I think that's a great example too, because it provides a really nice inroad to that mean safety conversation, right? Because you're looking at the chain together and saying, I had 6 drinks before, before this all started. So it's less of you telling the client that they need to do this thing and more of a like kind of looking at the evidence and considering what would be in their best interest.
Yeah, like it seems like every time this happens, and that brings up another good point. Often when I'm seeing someone in the context of like we have this a suicide consultation service here at the MIRAC, I'll do several chains, and then that's cool because you can kind of relate it to their behavior in the past week. So we might do a chain related to a suicide attempt, then we might do a chain related to ruminating about suicide, right? Each of those will give you different information, but if you do them kind of enough over time, a cool thing can happen where you kind of compare chains, and that gives you cool data about what's happening with that person's behavior and with the consequences of the target behavior. But it also
can actually see like whether they're able to interrupt it or
totally,
whether any of the things that are happening in the chain are less severe than they might have been before or different.
Yeah, and it helps them again. Like the goal of really this skill is for. It's a complicated skill, but it's for people to be able to kind of like do this skill cognitively while they're experiencing these things, to be able to like say, whoa, like this interaction with my boss tends to be triggering for me. Like what am I experiencing before I react to it? Or this interaction while I was driving to work today, like really upset me. Like how do I kind of notice that and slow down in the moment, and then sort of like do this, like do a mini chain in my head. So really the goal with this skill is to help our veterans to kind of become empowered and learn to be their own therapists related to this. Yeah.
So kind of in the outgrowth of this from DBT, I don't know if it's originally, for the first discovery was DBT, but certainly used extensively in DBT and actually is like a DBT worksheet, right? It's something that clients are taught how to do independently. So I really like that point of, this isn't just some fancy assessment measure that you have to have a degree in, some sort of mental health field to use, but rather a useful tool to help people understand their own behavior.
Mm-hmm. Yeah, absolutely. And I think with that, what's nice is you have, you're documenting the client's own experiences verbally, and you're providing them with like, hey, this was your experience of this. This is how you characterize this. That can be really nice for documentation too, to kind of really augment your suicide risk assessment.
So certainly something that can be used after crisis to better understand what happened, can be used on more of a continual basis in regular therapy. Where else, where our lens tends to be focused on the VA system of care, but where do you else could you see this being used? Are there any other like on types of providers that you would recommend use this?
I mean, I think my hope for this skill is that it would be kind of almost as standard, really, as suicide risk assessment, because I think it's so powerful. But no, I think any person that you're working with who has a behavior that they want to change. So I mean, I think there's evidence. It's cool because there's evidence for, and this certainly, the chain analysis it occurs in the context of DBT, but doesn't have to be always rooted in DBT. But DBT and ACT and all these transdiagnostic therapies that we have focus on a ton of different symptom topographies, symptom presentations.
Right.
So yeah, I mean, this can be used for substance use. This can be used for isolation associated with PTSD or depression, just to kind of slow down and get awareness about behavior. This can be used for eating disordered behaviors. Restriction is a behavior.
Violence for sure.
Yeah, no, that's a really good point.
Take-home message, right? Really flexible tool.
Maybe 20
can
minutes.
Be used in a lot of different treatment settings. Is important to do it in sort of like to fidelity, or like doing a good job and really doing it in a collaborative way, where you're validating the experience and making sure you're not missing big components of it. We talked a little bit about how in informing treatment it could inform a safety plan, and I just wanted to kind of echo that or like augment that again, because I think this type of assessment really maps on beautifully to helping people understand like step one around their warning signs,
all the steps.
Step 2 around like things they can do on their own for personal coping. Step 3, a lot of times you'll find out in the vulnerability factors or potentially more of the social relationships, who you could involve, and we already talked a little bit about how it can help support those means safety conversations or conversations around access to things that someone could kill themselves or hurt themselves with.
Mm-hmm.
How can people learn more about doing a change?
Yeah, so I think there are kind of a number of different ways you could learn more depending on how much time you have and the resources that you have. I think you could certainly check out our website at the Rocky Mountain MIRAC to read the article that we referenced. I think certainly the best training in doing something like this is getting really well trained in interventions like dialectical behavior therapy or acceptance and commitment therapy, but that's not required, and certainly if it's not accessible to you, that's okay. I think also stay tuned because I know that we'll be doing some more with this. You might see opportunities at conferences in the future to be trained in chain analysis. You might see more products from the MIRAC related to chain analysis. I think it's an area that has a lot of potential.
Yeah, I think it's a really useful and simple tool, and one that can be used sort of regardless of what your theoretical orientation is. So I hope that people will have the opportunity to try this out and see how it might fit in the work that they're currently doing. Yeah,
there are also, like, if you have access to journals and books and things like that, there was a recent DBT book that came out with a chapter on chain analysis that Sarah Landis wrote. That's a helpful resource. There's a cool article on chain analysis from Shireen Rizvi from a few years back. I think we cite it in this chain analysis paper that we're referencing. And then there's some cool work too from on mechanisms of DBT. There was a cool paper that Thomas Lynch published on the functions of the chain analysis and its use as kind of an interventional strategy. And then of course you can check out any ACT books that talk about functional analysis, and also the standard DBT kind of training manual.
Excellent. So maybe as things move along, we can add some of these references or resources to the website, and look forward to seeing how people react to this podcast. And,
totally.
And hopefully are able to use this in their clinical work or personal experience.
Exactly. Yes, I think it's to apply it clinically. It's something that you should absolutely be applying personally.
Yeah.
Yeah.
Well, I thank the Rocky Mountain Short Takes on Suicide Prevention for the opportunity to do this podcast and talk a little bit more about using chain analysis. And Lauren, thanks for your time.
Thank you. Yeah, it was fun, Sean.
Thanks for joining us today on the Short Takes on Suicide Prevention podcast. This podcast is made possible by the generous support from the Rocky Mountain MIREC for Veteran Suicide Prevention out of the VA Rocky Mountain Regional Medical Center. Be sure to visit our website at www.mirec.va.gov/VISN19. And while you're at it, if you found value in this episode, head on over to your favorite podcasting app to subscribe and give us a rating and spread the word. Tell a friend about the show and be sure to tune in every other Tuesday for new episodes. Our mission is to prevent suicide and help veterans build meaningful lives. And when you listen to our show, you see the possibilities.